Is ADHD just a phase that kids are going to eventually outgrow? Or, hey, maybe it's just caused by eating way too much sugar, right? If you've heard these claims, you are definitely not alone. But the actual science paints a drastically different and honestly a far more fascinating picture.
Welcome to This Explainer. Today, we're on a mission. We're going to decode the real, evidence-based science behind attention deficit/hyperactivity disorder, or as we all know it, ADHD. We're going to dive right in and fundamentally shift how we understand this highly misunderstood condition, and we'll be doing it using the absolute latest clinical guidelines from global health authorities.
So here is our roadmap for today. First, we'll look at the truth about ADHD. Then we'll literally go inside the ADHD brain. Next, diagnosing across the lifespan, followed by evidence-based treatment options. And finally, we'll wrap up with thriving and future directions.
All right, let's jump straight into Section 1, the truth about ADHD. For decades, people blamed ADHD on, bad parenting, laziness, too much sugar, or just a lack of discipline. A lot of folks thought it was just a childhood phase that you'd magically snap out of. But modern medicine tells us a completely different story. ADHD is actually a really common neurodevelopmental disorder. It has a huge genetic contribution. It involves polygenic inheritance, which basically means it's not just one single gene causing it, but rather a really complex combination of many. And this is absolutely crucial to note. While early treatment definitely improves outcomes, ADHD can, and very often does, persist right into adulthood.
Moving right along to Section 2, inside the ADHD brain.
Okay, to really understand ADHD, we first have to wrap our heads around this foundational concept, which is executive function. Think of executive function as your brain's internal management network, almost like an air traffic controller. It's entirely responsible for things like attention regulation, impulse control, working memory, planning, the whole shebang. When we talk about ADHD, what we're fundamentally talking about are actual differences and disruptions in this exact executive function network. And these disruptions happen in very specific physical areas. The key brain regions involved here are the prefrontal cortex, which is kind of like the CEO of your brain, along with the basal ganglia, the cerebellum, the anterior cingulate cortex, and the limbic system. In individuals with ADHD, scientific research shows us distinct differences in how these brain regions develop. In fact, in some cases, we see delayed cortical maturation. That just means these specific areas take a little bit longer to fully develop. So, those external symptoms we see, they're not behavioral choices. They are a direct result of the unique neurodevelopment of these specific regions.
But hey, it's not just about the brain's physical structures, right? It's also about the chemicals that communicate between them. Let's walk through this pathway step by step. The brain uses neurotransmitters to send messages across synaptic transmission networks. Now, in ADHD, there are distinct differences in dopamine signaling, which handles things like reward processing and attention, as well as differences in norepinephrine signaling, which regulates your alertness. When these chemical pathways don't transmit in the typical way, a person experiences executive dysfunction, meaning it becomes chemically incredibly difficult to just regulate focus or curb impulsivity. Let's look at how this plays out over time in Section 3, diagnosing across the lifespan. Now, according to the diagnostic guidelines in the DSM-5-TR, ADHD symptoms actually have to begin before age 12, and they have to occur in multiple settings. But here's the thing, those symptoms evolve as a person grows up. A preschooler, for instance, might show constant movement and have frequent accidents, but a school-age child, they might face more academic difficulties and physical restlessness. By adolescence, this often morphs into risk-taking behavior, poor organization, or emotional dysregulation. And in adults, well, it frequently presents as occupational challenges, poor planning, and this really deep sense of internal restlessness. The core neurobiology stays exactly the same, but the outward signs adapt as the person goes through life. It's also super important to realize that ADHD doesn't look the same in everyone. There are basically two primary symptom domains. On one side, we have the predominantly inattentive presentation. These folks might avoid tasks that require sustained mental effort, they frequently lose items, and sometimes they appear like they're just not listening. On the other side, we have the predominantly hyperactive impulsive presentation, which is characterized by constant fidgeting, blurting out answers, and basically feeling driven by an internal motor. Now, a lot of people have a combined presentation of both, but this difference is exactly why the inattentive types can sometimes fly totally under the diagnostic radar, because you see, their struggle is mostly internal. It's not usually disruptive to a classroom setting.
Because of all this variation, getting the diagnosis right is incredibly complex. Clinicians have to carefully differentiate ADHD from or identify it alongside other associated conditions like autism spectrum disorder, anxiety disorders, and learning disorders. And here is a vital fact from our sources. There is absolutely no single blood test, brain scan, or laboratory test that can just magically diagnose ADHD. None. It requires a comprehensive clinical assessment. That means looking at developmental histories, using rating scales, and getting multiple reports from parents and teachers just to ensure that the symptoms aren't better explained by something else.
Now for the solutions. Section 4. Evidence-based treatment options.
When it comes to treatment, major organizations like the American Academy of Pediatrics and the WHO strongly recommend a dual-pronged approach. On the medical side of things, professionals might prescribe stimulants, like methylphenidate or amphetamine-based medications, or they might go with non-stimulants, like atomoxetine. These medications actually work directly on those dopamine and norepinephrine pathways we were talking about earlier. But medication is very often paired with behavioral therapies. This dual approach includes parent training and behavior management, cognitive behavioral therapy, which is especially helpful for adults, and school-based interventions like individualized education programs, or IEPs. It is all about building a comprehensive ecosystem of support. Alongside clinical treatment, everyday lifestyle and daily management strategies are highly effective tools. We're talking about things like regular physical activity, maintaining consistent routines, ensuring adequate sleep, eating balanced nutrition, and using practical time management tools. Now, I need to clarify something really important here. While these healthy habits absolutely, without a doubt, support overall functioning, the medical guidelines make it very clear that they do not replace evidence-based clinical treatments when those treatments are actually indicated. They are complementary, they are not a standalone cure. Finally, let's look ahead to Section 5, Thriving and Future Directions. To see how this all comes together, let's look at a real clinical case scenario. Just imagine a 9-year-old child who presents with predominantly inattentive ADHD. They aren't acting out, but they are struggling silently to focus in class. So first, the family receives targeted parent training, and the child gets some specific classroom accommodations. Then, medication is safely introduced and closely monitored by their pediatrician. The result? The patient experiences drastically improved academic performance and overall functional outcomes. This right here is the tangible, incredibly positive impact of an evidence-based intervention journey. It literally changes lives.
And honestly, the science is only getting better. Looking ahead, international clinical guidelines are exploring some truly amazing new frontiers. We are seeing rapid advances in genetics and brain imaging research. We're stepping right into the era of digital therapeutics, using artificial intelligence to aid in much more precise diagnoses, and even utilizing wearable technologies to track symptoms. The ultimate goal here is precision medicine, highly personalized treatment approaches that are tailored directly to the unique neurobiology of every single individual. We've covered a massive amount of ground today, all the way from neurotransmitters to behavioral therapies. But I want to leave you with this really powerful summary quote directly from our source material. Understanding ADHD reduces stigma and helps unlock each person's unique strengths and potential. By embracing the facts, early recognition, and educational support, we really aren't just treating a disorder, we are actively allowing individuals to thrive in school, at work, and in all of their relationships. So, I want to leave you with this final question to ponder. As our scientific understanding of the ADHD brain continues to deepen, how will we choose to reshape our schools, our workplaces, and our everyday lives to finally unlock all of this hidden potential? Thank you so much for joining me to explore the science of ADHD today. Keep learning, keep asking questions, and I will see you in the next explainer.